Hey guys, welcome back to San Antonio Living. It's something that many of us have, but you might not even know that you have it. Maybe you're grinding your teeth at night, and that could actually lead to something much more and bigger problems. But now there's an FDA-cleared medical device that can help you with that. And here to talk to us about it, we're talking to Dr. Christopher Perry from Perry Dental Health and Associates. How are you?
Very well, Lana. How are you?
Doing well. Okay, so this morning we are talking TMJ.
Yes.
All right, now fill us in exactly what TMJ is, because I think I might have it wrong. It's not just grinding.
Well, TMJ is a catch-all phrase that relates to the temporomandibular joint, which is this joint right here, and the disease is actually TMJD. So it's a dysfunction of the jaw joint and all the surrounding things that are involved in chewing, speaking, all the musculature. And actually musculature ends up being the big problem. It's what really hurts long term, and the muscles throw off the joint. And so it's not just that you're clenching and grinding. That may be a symptom of a problem.
When you're sleeping at night.
Exactly.
Okay.
But also during the day. So often folks come in and they have some kind of a headache and they think it's a TMJ related issue. And I say, you know, there are three causes for this TMJ.
Okay.
One is, and they're often related, one is some kind of a bite imbalance. Your bite's just not quite right. It's like having a pebble in your shoe. And you would sort of walk funny and your muscles would all go sort of crazy and your hip would start to hurt.
Right.
Oh, that's not good. And the second is stress. And that's the big one. It's the thing that's...
Stress always does it.
It's not the easiest thing to manage. I can't come home and say, you know, stop being stressed. and then the third one often is actually a sleep disorder where they're not breathing. So if patients have apnea, it's very common that they start to develop hyperfunction of their musculature because they're stressed while they're sleeping.
Okay.
So all the time I wish I could tell patients, you know, relax, take a deep breath. But I'm not there all the time. So we make them these bite splints that they put in their mouth to help relax the musculature and take away that pebble in the shoe or to relax the muscles. But they can't wear a bite splint typically during the day. And
that'd be really hard to wear a bite splint and try and talk on television.
yeah, I don't think you would really like that. I don't think everybody would understand you, and you certainly wouldn't be as camera ready as you'd like. But with TMJ Next Generation, we can actually treat you throughout the course of the day, 24 hours a day. So it's a little ear insert that's hollow that you can hear through, that goes inside your ear, puts a little bit of pressure, and it's like Dr. Perry sitting there telling you, don't clench your teeth, relax. Don't bite so hard. Decrease the inflammation.
So it's TMJ Next Generation. This is the device we're talking about.
Exactly.
And so when we were talking earlier, I was thinking, okay, now this is something that affects your jaw. It hurts. It causes migraines. Again, you grind. All this stuff that's happening in your lower half of your head, but you're doing something in your ears.
Right, exactly.
And that connects.
The jaw joint is right here. And so as you can see on the animation, the device is going in the ear, creating a little bit of pressure, just a gentle amount of pressure. And it's a little deterrent, a little dissuasion saying, don't put so much pressure, because every pressure, every muscle as it contracts is pushing the jaw joint. And so this is sitting there saying, you know, just sort of stop it. Relax.
Relax a little bit. It's like that voice in your head, but instead it's actually in your ear. Exactly.
And by relaxing all the musculature and stopping the habits, or at least relaxing the habits, we can really get to the cause of the problem. And that's the real goal, hopefully in dentistry and medicine, which often we're treating those symptoms and we're not getting to the cause. And this is a great tool to help us get to that cause.
Okay, I'm going to make sure I have this right. So the TMJ Next Generation, I say it, ear implants, would that be the right way to?
An insert,
An insert, an ear
removable,
insert.
fully removable.
And it'd be an alternative to the
bite splint, the night guard, yes.
There we go.
Yes.
I think I'd rather have something up here than something in my mouth all the time.
And the big key is that you can wear it all day long.
Okay.
And so it really helps break the cycle, the destructive cycle of clenching, grinding, and all the other causes of TMJ pain.
Now, is this something you suggest leaving in 24/7?
We do initially. We actually send you to an audiologist who takes the impressions of your ear. I, as a dentist, don't take impressions in the ear.
Right.
And then the inserts are sent to me because I'm managing your pain and your headaches and all of that kind of thing. And you wear it initially for 24 hours a day, and the goal being that we start to figure out what the problem is.
And this is a picture here of
the audiologist taking impressions of the ear. And so it's a very non-invasive, actually it's the same way they would take hearing aid impressions. And these are the technicians here, made in the U.S., up in, I think, Wisconsin now, is where their factory is. And they actually use 3D printing to make these little custom inserts that go in the ear.
Well, Dr. Perry, this is great. You have a lot of information. I feel like you need like the whole hour just to really break it down, but I think you did a great job.
I could talk about it all day if you want me to fill the hour.
Well, I can see you're passionate about it. I know you're helping so many people that have that problem, that have that migraine, have that pain. You guys, I want you to contact Dr. Perry. You can see him or contact him at
888-210-Dr. Perry.
And if you want some more information on the TMJ Next Generation device, the information is right there. It's very simple. It's tmjnextgen.com. Dr. Perry, thanks so much for coming on this morning.
Thank you so much, Alana.
I
Really
learned a
enjoyed
lot.
it.
Thank you.
you.
All right, guys, coming up, how a local organization is enhancing the power of community and developing leaders in hopes of changing the world. Meet our next 10 Days of Giving recipients